So I think when I first started working in the community, mental health still wasn't necessarily talked about that much in schools. There was still a little bit of a stigma about it. And I think one of the wonderful things was I was in a school a couple of weeks ago and a young person said to me that there isn't a stigma in mental health to adolescents, that's an older generation thing. And I was like, what a wonderful thing to be able to be told. But at the same time, she felt that they'd been told so much about mental health and what to look out for that they hadn't been told how to look after themselves, and that they were no longer being taught ways in which to look after themselves and look after their own mental health and well-being, but they were being told lots of symptoms of when things might be going wrong, and instead of that making them feel empowered, it made them feel scared of, you know, she described a situation where she'd watched a mental health campaign as part of PHSE and had convinced herself she had bipolar because she listed several of the symptoms. Well, those several symptoms are being a hormonal teenager, you know, but it put in the wrong context. So it was really interesting having a conversation with her because she was like, actually, have we gone so far one way that we haven't balanced the conversation? And I wonder if that is part of where we're going, but I do think it's never been harder to be a teenager. Like, it's never been harder to be a young person, child or adolescent really, in this country, because the pressures that we put on young people are severe. We did a study last year with an app called Childwise that we were using in secondary schools. And we were able to find that actually children started secondary schools more emotionally resilient than they left in year 11. So our 13-year-olds are more emotionally resilient than our 16-year-olds. And we could track it via their exams, so it started dipping in year 9 and it bottoms out at the end of year 11. Because we tell children and young people that their self-worth can be attributed to a grade. And we can put a number on your self-worth. And I think that pressure and that idea that everyone has to go to university and somehow if you become a builder or a tradesman, that's less of a status, less of a career than if you do a degree, even though actually, you know, it takes a real skill to do those things and we need those jobs. So I think that shift has made it really difficult to be a young person now, and we're seeing that in mental health services, we're seeing that in the huge demand for CAM services. Over the time that I've been a nurse, there's been a massive drop in preventative mental health, and as a result we cannot keep up with the number of young people coming into CAM services to a scary degree.